Leuka started in 1982, and it was really the brainchild of a patient of mine with chronic myeloid leukemia. And the progress we've made in terms of curing different forms of leukemia in the last 20 years have been very remarkable.
In December 2013, the medical world lost Professor John Goldman. He was a towering figure in the field of leukemia research.
He built all of this on the fact that he was relentlessly focused on doing the best thing for the patient, and that was all that mattered.
John's achievements were amazing, but the battle against leukemia is far from over.
Thanks to work of John Goldman and others, there's been tremendous progress in CML. That isn't the case for a large number of adult cancers.
Today, the charity he founded, Leuka, needs your help to continue his legacy. In the 1970s, the diagnosis of CML was a death sentence, with an average life expectancy of 5 years after diagnosis. John became the leader of a global group of researchers trying to cure the disease.
John had a special gift. He could make everyone kind of forget their own individual agendas and their own competitiveness and come together with a common goal of advancing the field.
Somehow he just conveyed his belief in your ability. And if there's nothing so powerful as having someone really believe you can do something.
People are quite good at kind of knocking you back and telling you that things may not work. But John didn't see life that way. He made you realise that anything was possible.
One of the researchers was Brian Druker, a then unknown investigator who had identified a drug that could potentially shut down the disease, but was unable to persuade the drug company to develop it.
There was enormous skepticism. The general view was, when has one drug in cancer ever worked? So why do you think one drug is going to work now? This is a really difficult time. I had patients who were dying of their leukemia, and I couldn't get access to this drug. And I presented this at the American Society of Hematology meeting. After my talk, John came up and said, "Can I talk to you about it?" I said, "Well, sure." And let me sort of set the scene for you. I'm 2 years into my first appointment, and the most prominent person in the entire field of CML wants to come and talk to me. And so he was on board before anybody else in the entire world knew about what we were doing. I was lobbying Novartis, and John was the other critical voice in convincing Novartis to move forward to clinical trials. In June of 1998, we went forward, and we were 4 months in, and I pulled John aside and I said, "John, it's working."
A major development in cancer research announced at a conference in San Francisco. Scientists reporting positive results of a simple pill that can zero in on cancer cells.
The word breakthrough is one that I really do try to avoid, but if it's ever applicable, it is in this case.
Today, a patient with CML has an 85% chance of living a normal lifespan. It's an amazing turnaround. But sadly, progress with other forms of leukemia has lagged.
The best case scenario for treating acute leukemia gives only a 40% chances of being cured, so there's still a very long way to go.
The question is, what are we going to do about it? Today, Leuka is raising vital funds for more research. The John Goldman Fellowships for Future Science will provide critical support for the next generation of talented scientists and doctors working to cure leukemia.
Most of the important discovery in medicine in the last 200 years have actually been made by junior people. So that's why it's so important that actually we don't lose the ideas of the younger generations.
If you back the right people, you support them, and you get them going in the right direction early in their careers, you've made an investment for life.
There is money for well-established investigators and well-established groups to carry out their research, but there is a big hole in the area of junior scientists.
It's sort of young people who have new ideas, completely crazy ideas, different kinds of inspiration. So I think the future of leukemia research really depends on identifying people at early stages of their career, giving them the tools they need. And I think that's why this particular fellowship approach is so exciting.